I got cancer. And so I can't help but to contrast what would I have done if I had gotten cancer while I had no health care. Because, you know, I had state-of-the-art help, and I wouldn't have had that. There's just no way in the structure that we have that I would have had the level of care that I had. And now I have a 30-year-old son who has a bachelor's degree. He works very hard. He's going back for his master's, and he doesn't have health insurance. He can't afford health insurance. So you mentioned, you know, Obamacare being a bomb, you know, that was dropped on us. And the things that I'm reading here in the literature, you know, are about regulations and what, you know, and I don't know about that. I do care because of how it impacts me. If the markets are to decide about health insurance, I don't trust corporations, honestly, to do good by us. So all these regulation things aside, what are you going to do for people like me and like my son? And there are many of us in this room, in this country. What are you going to do for us about health care, never mind the regulations?
First of all, how are you doing?
I'm okay, thank you. I'm cancer-free.
As someone who helped to organize and get a cancer institute off the ground out west, those are the most powerful words in the English language. I'm cancer-free, you know that? So I wish you the very best as you go forward. Keep hope alive, that's a pretty powerful thing where you are. And I wish you the very best in that pursuit.
Thank you.
I think one of our biggest problems today is insurance companies are not doing what insurance companies are supposed to do, and that's take a risk. And I want more in the way of affordable insurance policies. We went through the same thing in our state when we did healthcare reform. We had, you know, 14 or 15% uninsured in our state. And I'd say the largest subset of the uninsured was what I would call the young immortal population. You know, 18 to 35-year-olds. They're never going to die. And even if they wanted health insurance, there's nothing to afford. So we worked with insurance companies, you know, over 2 to 3 years, and we got an affordable, accessible insurance policy. If you wanted to buy it from this state, you can't, because of the cross-state purchasing restrictions that are in place. And I say that's not fair. I say one of the first things I would do as president is to eradicate those barriers that stand in the way of allowing the marketplace to deliver affordable policies, which they're not doing today. We also have to get our identifying the cost drivers. That's the biggest problem of all in healthcare these days. Really two problems. The drivers of cost and the inability to access affordable policies. I think we can fix both. But in order to fix number one, we've got to recognize that healthcare is a $3 trillion industry, the size of the GDP of France. And any expert would tell you that 40 or 50% of that, almost $1.5 trillion, is wasted and needless spending. So you go into a doc's office, nobody knows what costs are. Patients don't know what costs are. Doctors don't know what costs are. Nobody seems to know what real costs are. You go in and they want to take a picture of your knee after knee surgery or shoulder after shoulder surgery. You can do an x-ray for $100. You can do a CAT scan for $2,000. Nobody seems to be able to set you straight in terms of how you can cut costs out of the system. I want to get to a point in time where patients walk into the doctor's office with a sense of knowledge and a sense of understanding about what options are available and what they cost, and then having insurance options that actually cover that. So if you're not on a state policy, if you're not on a federal policy, then there ought to be something in the next tier that is accessible and affordable. And that's where we have a problem, is in that tier right above those who don't necessarily qualify for a federal or a state program. And I think we need to work with the insurance sector in, first of all, breaking down the barriers that make it impossible for you to access an affordable insurance policy somewhere else, or for your son to be able to do that. That's just not fair. That's not right. But driving toward recognizing the drivers of cost in the system. What is driving the double-digit health inflation we see year over year over year? There's some very serious cost drivers that we have to deal with. And then the other piece of it really is working with the insurance companies and getting them to do what they're supposed to do, take a risk, in offering more accessible and affordable healthcare policies that fit whatever stage you happen to be in life, to happen to fit your economic situation, your health condition. We just don't have enough of them. I'm here to tell you we're just beginning the journey that this nation needs to take in order to get to where I think we can be. I believe this mandate is going to be under Obamacare. I think it will prove to be unconstitutional, and then we'll kind of be back to square one. And moreover, you're going to have almost all 50 states who are going to say, well, not Massachusetts, I think they've already decided to go their way. But you'll probably have most of the states that will say, we want a waiver from Obamacare. And so we're going to live in a nation of carve-outs and waivers. I mean, talk about a confusing situation, because these states are not going to want to take the mandates that are imposed on Obamacare, either through Medicaid or through the additional costs that will be foisted on them via the mandate. So it's going to be a very confused environment. I say there's only one way to resolve it. And I know that people are very passionate about it, and I understand that. But we've got to start from scratch, and we've got to do it fast, because people are suffering and they are hurting.